We don't.
Okay. You and I know that Nigeria has the second largest HIV epidemic in the world. We're also talking about one of the highest rates in new infections and mother-to-child transmission. Mohammed says something about the treatment program being fashioned, in line with adults. For the adults, and of course talking about the user fees. How do you want to address that so that you can bring in more people, more adolescents and youths, to the treatment program?
So this is absolutely important. Whenever you are delivering services, it's very important that you you modify the service to really be inclusive. Young people may not necessarily access normal clinics. Young people may not necessarily have the patience to sit down for a whole day trying to see a doctor. And we do realize this. And that's why we're trying to change the way we deliver some of these services. We are using a lot more what we call peer-to-peer support. We are also providing more innovative channels for reaching us. When it comes to treatment, the good thing with treatment is that most of the drugs nowadays they are very tolerable and they are taken only once a day. If you give a young person a drug to take 3 or 4 times a day, it's not going to happen. They have other things to do other than sitting down and taking drugs 3 or 4 times a day. So in a way, the drugs have changed. And I think moving on over the next few years, we're going to have even more convenience when it comes to taking these drugs. We may have drugs that may be taken less frequently or even taken as injections every 2-3 months, which will definitely help. The biggest challenge we have when it comes to treatment with young people is not just confined to this particular environment, it's across the world. We all know it's difficult to get young people to engage in health-related activities, including treatment. And we have to make it easier for them. And to make it easier, we need to design programming that allows them to have the drugs for a longer period of time, so having 2 to 3 months at a time, and being able to reach them where it's easiest. So where do you find young people? You find young people in schools, etc., and therefore designing programs that enable us to reach them through this means, and also through community pharmacies, etc. But overall, it's just like with the adult population, really. It doesn't make sense asking people to come to access their treatment, and it's very inconvenient. You've got to make it easy for people to get those drugs, and you've got to make it easy for people to access their laboratory tests, etc., without spending the whole day trying to get this sorted. And we are definitely working on this.
Yeah, what about access to antiretroviral drugs?
Yes, it's tongue twisting.
It is.
Yes, so antiretroviral drugs are available throughout the country. Yes, there are. Because Nigeria is such a big country, we do have occasional periods of shortage that has to do mostly with logistics, etc. But across the board, at the moment, we have close to 1.1 million Nigerians on treatment. The majority of them are on treatment through the US government program called Pt.4, and about 150,000 are on treatment through Global Fund, with about 60,000 in Taraba and Abia. I know there have been challenges with the issue of user fees, which we are currently working with the Honorable Minister of Health to try and resolve, because it's definitely a bottleneck. Some facilities continue to charge, particularly for laboratory tests or for cards, etc. But as far as we are concerned, in NACA, HIV services should be delivered free. Treatment for HIV is not a luxury, it is a right. People have a right to access their drugs, because it's by taking their drugs that they will be healthy and they will remain alive and well to look after their families. So we're taking this fairly seriously. And again, I would like to emphasize that we do not sell HIV drugs. Antiretrovirals are supposed to be free. They are brought in free into the country. So none of our facilities should be charging for the medications themselves. They may charge for certain blood tests like full blood count, etc., but even in those cases, they shouldn't be charging for HIV-specific tests. And we are working very closely with our partners to identify those facilities that continue to breach those rules and engage with them. From the side of the adolescent and young people, one of the things I wanted to say is the best form of HIV vaccine, if a vaccine exists for HIV for young people, is actually keeping them in school, particularly young girls. Young girls remain social assets, and by keeping them in school, by delaying the age of sexual debut, by trying to strengthen their family and social networks, by reducing their vulnerability, is the best way to protect them from HIV, really. And this is a message that we would like to really push out. And for those young people listening to this program, it's important, if you're sexually active, it's really important you make sure you protect yourself, and it's important that you get a HIV test done as well, because that's the first step towards protecting yourself and your loved ones.
Yeah, that's the question I was going to put to Mohammed. If you have something to tell the youths and adolescents watching you right now, what would it be, for instance, to those who don't even know their status, and those who know perhaps they are positive, what next step they should take?
Okay, well, I'll start in reverse order. To those who know that they are HIV positive, members of my network, and those who are yet to be members of my network, I would say do not despair. Living with HIV could be a scary experience if you don't have adequate knowledge about it. So I would say you go to the hospital. I know it could be challenging, I know it could be stressful, I know it could be inconvenient sometimes, but go to the hospital, talk with the counselors, talk about those things that you are going through beyond drugs. Beyond drugs, talk about those emotional things you are going through, because your emotions inspire your behavior. And you wouldn't want a behavior that moves you towards non-adherence to your medications. So talk to counselors, talk to health professionals, and follow their advice. There are peers that you have who are also living with HIV, who have done well on treatment, just like being in school. You are doing badly at math. There are classmates you have that are doing well at math. You need to make friends with them, talk to them, and they will hold your hands and help you get better at treatment. And everywhere you are, you could find associations, small support groups of young people living with HIV. It's a good way to start. Join such groups. You'll find people with stories to share that resemble yours or could help you think better about yourself. And they could inspire you to better treatment outcomes. And then for those who are not living with HIV, who do not know their HIV status, I prefer to say that. I would say testing for HIV is a big step to take, but it's a very responsible step to take. For many young people, we think that we need to wait until we get a sign or something that pushes us to test for HIV, but that's not the case. Many people have suffered great challenges waiting for something to happen before they test. Do not wait until your story becomes like that. Go get a HIV test. What you see as a result of that test does not determine you. What determines you is what to do about that result. So do something positive about that result. If it's positive, do something positive about it. If it's negative, do something positive to stay negative. Prevention of new infections starts with your conviction that I want to prevent myself from HIV infection. It's not something that happens by